Hi, I'm Santa Clara County Supervisor Dave Cortese, and for those of you who have tuned in before on Saturdays at 3 o'clock, this is our weekly town hall meeting and discussion on COVID. Obviously, it's a town hall meeting of virtual reality. We don't have you here with us, but you can call in, you can text, and you can post on Facebook Live your questions, and those will get picked up. And just a few minutes ago, I was told that questions are already coming in today. So we're just going to speak for a couple minutes. I want to introduce our special guest today, and then we're going to get right into questions and answers. But let me give my usual recap of what's happened since last week. And while I'm doing that, I want to once again thank the Vietbay studio. They donate the studio to us week after week after week to do these shows on behalf of the County of Santa Clara. And my supervisorial office and the guests that show up here from the county. But they do a terrific job and have a very professional production here. So to Min and all the others here, we thank them very much. There are 3 staff members you can't see here because we're all distanced 6 feet apart. And that would be Tara Sri Krishnan, Tevu Nguyen, and Janice Rombeck. And all of them play a role on our communications team and constituent response in the office. So we're prepared to answer your questions as best we can as they come in. But since last week, some good things have happened. Testing numbers per day are up. People have been asking us if we can get those testing numbers up. Many of you have asked us that. And last week they went over 4,000 a day, and in some cases, and they continue to roll out. What we're very, very happy about is the weekly mortality numbers that we were seeing. The death rate that used to be in double digits every week is now down to very low single digits. The last 2 weeks we've been able to come here on Saturday and as much as we mourn the deaths and its grief and we're sorry for the families, we still have to say that 2 deaths per week is a much better indicator than a couple dozen. And I'm not going to give my usual lengthy background on how things are going because I want to introduce our special guest, maybe let him say a few words of further introduction, and then we'll get right to the questions. And our special guest today is Mr. James Williams, who is the County Counsel for the County of Santa Clara. He's been in that position now for some time. He does a job there that I'm very proud of. He has not only a national reputation individually, as an attorney, but his office was recently named our county's county counsel office. His office was named the #1 public sector law office in the country, and it's just an indication of the kind of the work they do, whether it's on behalf of DACA students or others in the community at a larger scale, or just fighting these battles to protect our county treasury, to save taxpayer money and to make sure that people stay healthy. But the importance of James here today, or the relevance of having him here at a COVID town hall meeting is because he actually is in the Emergency Operations Center every day. This is a typical case of somebody putting the whole county ahead of their personal interests because he has a young family and a lot of other things that he would like to be doing, just like all of us. And he's spending 7 days a week and many, many hours, not only in the Emergency Operations Center, but writing the rules, writing the protocols to get businesses open, and helping to guide Sarah Cody as to what can legally be done and what can't be done from a legal standpoint. We'll talk about that some more, but James, thank you for being with us, and why don't you say a few more words about what is it like to be, what is a day in the life of a county council these days?
Thank you, and first I just want to thank you, Supervisor Cortese, for having me on. It's really a great opportunity to answer people's questions and talk with you about what's been happening. But you've also been such a tremendous champion of the work of the County Council's office in all of its facets. You mentioned our litigation, our affirmative efforts to protect the community, to stand up for immigrants, to carry out the policy direction of the board, but also our work on a day-to-day basis advising the board, but also the other county officers like Dr. Sarah Cody I'm very proud of the work of our office and the many, many people who have been embedded in the EOC, but just in general, the role that we play in helping support all the good work the county does. And you've been a huge champion of that, and I just want to publicly acknowledge that, and I think people don't always know that. They don't really know what a county counsel's office is,
Right.
but you do, and you understand that, and you recognize the role. So thank you for that. My role here, both wearing the county council hat, but then at the EOC, this is unlike any other kind of emergency, and maybe it's worth taking just a moment to explain that, because this pandemic is very different. As you know, before I was a county council, I was a deputy county executive, and one of my departments I worked with was our Office of Emergency Services and our Emergency Operations Center. And in a traditional disaster, we train all the time for an earthquake, right? For fires, the kinds of things that we don't want to see, but we expect we might have to deal with here in the Bay Area.
Right.
And the whole system is based on this idea of mutual aid, right? You bring in the resources from the state, you bring in the resources from the federal government, you bring in the help from outside of your region, and you saturate whatever part of the country is affected by a hurricane or an earthquake with all these external resources to help in the immediate response. What's different here with a global pandemic is everybody has had to deal with it themselves. And what's made things so much more challenging here with respect to COVID are the serious failures at the federal and state level, and widely known about testing, for example, and how much we have had to do locally as much as possible to try to fill in those gaps. So it's been an extraordinary response with all hands on deck from all across the county, to actually do even more than we would already be overwhelmed in trying to do in a normal disaster situation, to respond to this pandemic situation.
And it really is every county for themselves, which a lot of us don't feel it should be. We would like to see a stronger national response. It's not the philosophy of our national government right now to step in. When we came in, we were wearing masks, and the folks here handed us more masks because they're trying to protect themselves, and it's everyone's getting their own stuff, getting donations, giving out donations.
Yeah.
It's been like that from the beginning, and we don't want to grade which county's doing a great job and which isn't, but it really is a reflection, I think, on the people that we serve, the 2 million people in this county who have by and large cooperated with the rules that you've had a hand in putting out there, and I've had a hand in putting out there, I suppose. And of course, the expertise that we have in this county, we're very fortunate to have it. So that said, now we're on the hot seat and we have to answer questions.
Yes.
And people have hard questions that they ask us. So let's see what we can do. We won't duck anything. We might not have the perfect answer for you, and if we don't, we'll get it for you Monday morning. But let's see what we can do. Tara?
Yeah, so Philip is a Saratoga resident and a volunteer contact tracer for the county. And Philip asks, what will we be asking the community to do to help make COVID control more effective? Are some aspects of the June 5th reopening going to need to be reversed?
Great question. I'm not sure either James or I have enough information at this moment to give a definitive answer on that, but let's talk about the idea of June 5th, 13 more different activities, and business ventures opened up, different things. Virtually all office spaces opened up now for the most part, but short of a complete reversal, is part of your job and counseling Sarah to continue looking at what might need to be tweaked to this question. What if there is a little spiking and surging? Do you go back and look at maybe we just need to adjust a few things here?
Absolutely. I mean, I think one thing that people should know is that Dr. Cody looks at the data every day, every single day, and not just our local data, but what's happening elsewhere in the Bay Area, what's happening in neighboring counties, but also what's happening in the state and what's happening nationally. And the trends right now are definitely concerning, and she talked about that just yesterday. Even here in Santa Clara County, we've seen a significant increase in cases, and we've certainly seen a lot of increase in cases across the country in places that opened. And I think what it really calls for is that we need to redouble our efforts to be very focused on the basic safety protocols that from the beginning the public health experts have been urging us to follow. And that includes face coverings. The evidence grows with each study of how much of a difference face covering makes in helping to contain spread. And it's not so much about protecting you, it's about protecting others from you, and that's kind of a little bit of a harder concept for people to understand. But we need to make that a cultural norm about the 6-foot distancing and maintaining that vigorously, about the social distancing protocols and having businesses take those seriously and rigorously adhere to them, and making those messages clear. And it's hard when some leaders elsewhere want to debate things like whether we should have face coverings, starting with the President of the United States, right? And that makes it a little harder to get the message communicated clearly. But there is no debate in the public health community, right? The people that I'm listening to, that you're listening to, that our residents have really been doing a great job being attentive to, they are very clear about what those basic things should be. And we have to be rigorous about it, because even momentary lapses, right? Even saying, okay, well, not today, not tomorrow, it has to be a norm. It has to be consistent. It has to be like putting on your seatbelt when you get in the car. It becomes automatic. You always do it, always, every single time. It just becomes reflexive. And that's where we have to get as a community. It's hard, but that's what we need to be doing in order to see success in maintaining the opening and moving forward while maintaining safety.
Well, it's Tara, what else do we have in terms of questions?
So Yeffy asks, now that we have contact tracing, do we have any data on COVID reinfecting a patient who previously recovered? And do we have a record of folks who were sick and recovered?
Yeah, there's definitely data. If by no other means, you can sort of what I call back into the people who are recovered or recovering, because the other option is they're in our mortality figures or they're in the ICU and we don't know yet, right?
That's right.
But if they're not in one of those two places, then they're on the mend, and that's why we watch those ICU numbers and the hospitalization numbers so closely, as I understand
Yes.
it. But let me let you answer the rest of the question.
Yeah, no, that's exactly right. We basically presume that those folks after 14 days or so who are not hospitalized have recovered. Now, that doesn't mean that they haven't had other effects of this virus, because one of the things we've learned is that there are other serious health risks, not just the risk of death, but other illnesses that are appearing in some people who get COVID. It's a really nasty virus, and so that isn't going to be captured necessarily in hospitalization. But you're right. I mean, the way you back into that is to say, okay, well, after about 14 days or so, those who are not hospitalized have kind of been presumed to have largely recovered. Lawyers,
I'm one too, so I know, are always kind of careful with their language, right? That's what we're trained to do. And I always pay attention even to the reports that you put out daily, and people should know that the county council's putting reports out to the Board of Supervisors every day that are thorough, and you're not the only one. Here's what's happening right up to the second. But the language that says there were 3,984 confirmed cases of COVID in the county as of Friday, confirmed cases is a pretty important phrase, right?
Yeah,
Because
it's critical.
one of the things that makes it hard to answer this question, and it goes back to your earlier point, is the federal government was so slow on giving us testing or testing kits or even authorizing commercial testing. The whole system was so delayed from a national level
Yeah.
that in a sense we can't really tell you how many people recovered in perfect terms, right? Because we don't know how many people ultimately had it at this point, which is another reason why we want testing. The more testing, the better information we have, right?
You're exactly right about that. And frankly, it has been mind-boggling at how challenging it has been in this country to have ready access to testing. Because what the public health folks want, because they tell me this, right, is that they want anyone to be able to walk into any healthcare provider and get a test just as easy as it is to get a flu test or to get any other standard test. It should be super easy, super fast. And in a country like ours, one would have hoped, one would have expected, one would have taken for granted that we would be leading the world in accessibility and availability of testing. And we're still lagging even to this day. The good news is here locally in Santa Clara County, you can go to sccfreetest.org and find out information. The county itself, through VMC, through our own county hospital system, and the leadership of the board, and making sure we, when we saved 2 hospitals out of bankruptcy and have this robust clinic system, VMC has delivered. It's punched way above its weight in providing testing. We've got pop-up testing. So we now are actually having some real robust testing in the county. It's still not enough, but it is night and day better than it was even just a month ago, certainly 2 months before then. But it's filling a gap that really should be filled by the federal government and by the state.
Yeah, just since last Saturday, when we were here last Saturday, in that period of time, 1 week, 15,763 people have been tested here in Santa Clara County. As Mr. Williams was just saying, free testing. I mean, there's really no excuse for not doing it. You get the results typically in a couple days, if not sooner. And if you look at the screen right now, for those of you who are watching the screen, you'll see the website that you can go to get a list of all those free testing sites. There's plenty of sites around. We would like to see those at full capacity every day.
Yeah, one other thing I want to mention on testing is Dr. Cody recently did issue an order to large healthcare systems like Kaiser, like Palo Alto Medical Foundation, all the other large hospital systems in the county, Regional, Good Samaritan, so forth, to mandate that they step up to the plate and ensure that they're providing testing for all the priority groups. That order took effect on the 15th, and so people should be able to get much more access to testing through their own healthcare providers, and that's part of what needs to happen to even increase testing further.
Yeah, good. So don't worry about your health insurance card. Just head down there and get the free test, especially if you're experiencing any symptoms.
Yes.
Or if you've been around anybody else that got tested positive, or even if you're just suspicious about it, why not get tested? We could use the data. Again, the more tests we get, the more opportunity there is to understand the virus, and maybe if that testing comes out negative, you're just adding a little bit more argument to get the economy opened up a little bit more. So it's a good thing to do any way you look at it. So,
We
Tara?
want that.
Yeah, so we had a caller call in and ask for your analysis of why shopping malls were opened under phase 2 and not later.
That's a really good question for James Williams. I have had a role that we've talked about a little bit here, and probably more so down at the county as an elected official, as a county supervisor, of trying to be a go-between or a liaison between some of the people in churches and temples or malls or car dealers or construction or dentists, so that they could get their best ideas on paper, and turn them in to people like James Williams and his team, and they can look at them and try to get and get things opened up. Obviously, they have to convince Sarah Cody about that because she has the final signature on everything. But how were those decisions made? I mean, I think it's curiosity and confusion sometimes about, we hear sometimes people say, how come you could have Lucky Store or Walmart open selling food all the way back to March 17th. The mall, which seems to have more space, doesn't open up until June 5th. And then why would the mall open up at all if you can't go get a haircut? People are trying to understand the method to the madness.
Absolutely, and we get those questions all the time. By the way, I can't wait to get my haircut. But,
Mine's all tucked back here, believe me.
Let me try to kind of explain the framework because I think it's helpful. So the first set of shelter-in-place orders, and we issued the first order in the nation, right, before even the state order. The real framework was completely shelter-in-place. The exceptions were for things that were essential, right, things that you need to be able to access in order to continue to survive. One of which is obviously access to food, right? Groceries, access to healthcare, access to fuel, access to, things you might need in an emergency, for instance.
You're trying to tell me sports basement wasn't a necessary place for me to go? Okay.
Not at that time. Not at that time.
Right.
And so, it wasn't a determination that those things were safe. Nobody was saying that going to the grocery store was safe. What the public health officers were saying is that we know you need to go to the grocery store even if there's risk, even if there's significant risk, you still need to be able to do it. We're going to make it as safe as we can, but we can't close it. And so the essential business list had nothing to do with whether they were safe. It had to do with the fact that they were essential. Then as we started with openings, though, that's where layered on top of the essential framework was a risk-based framework. And so the first things that opened were really focused on outdoor activity. And there's now a lot of evidence, and increasing evidence, that outdoors is much safer than indoors. And so there's an effort to encourage, take your activity outdoors. The airflow is better, the ventilation is better, it's much easier to maintain distancing, the UV helps kill the virus, it's just better outdoors. And so the first wave of things had to do with outdoor activities, outdoor businesses, and that was risk-based layering. And then the next phase of things that opened up really had to do with what was the framework then that the state had created. Because after we had issued our first order, the state issued an order, and we're subject to the state's framework. And then the state created what they called their resilience roadmap, which was their framing of what could open. And so we could only pick off of that menu, so to speak. And so we looked at, and Dr. Cody determined, okay, these are the things that are lower risk off of that menu. And those were kind of the next set of things. And we did a big opening, as you mentioned, on June 5th, really significant, certainly with restrictions, but the vast majority of businesses after June 5th are able to open in some form or the other.
Yeah, some of it, if you've been doing this every day like you have, or even as a county supervisor where we have to interact every day because it's our job, with the experts, it may sound like, well, why couldn't you open up a banquet hall with a large dance floor because it's spacious, or people have their own ideas about things like this. But I'll tell you, when you've been working on this every day, it's fairly obvious that you're not going to be able to open up a crowded dance floor anytime soon. It's just a completely, doesn't matter about the space, it's a completely different set of risk than it would be to take a hike on a trail, up to Ed Levin Park, for example, or Vasona Park. They're just completely different risk factors involved.
You're exactly right. And there are going to be some things that, frankly, are not going to be able to open for a long time, a very long time, because of the risk profile. And one of the things, if you've got an enclosed space with a lot of people, even if it's a large space, if you have one of these super spreaders, right, you have now exposed potentially 100 people, 200 people, 300, 400, 500 people to COVID. think about the challenge for contact tracing, for trying to quarantine and isolate, to even figure out, how to do that and how to do that fast enough. It doesn't matter how many people you have. You've just created, boom, in a place where there could be an explosion of the virus that becomes an uncontainable chain. And so those kinds of mass gatherings, those were things that actually were banned before shelter in place, right? The first orders that Dr. Cody issued had to do with those kinds of events. And honestly, I don't think those types of things are going to open anytime in the near future. I don't think they'll open certainly anytime this calendar year.
Sure, even before shelter in place, she said, no gatherings in a single space of 1,000 people or more. So that kind of stopped the malls right there. It stopped a lot of things. It stopped large weddings, for that example, for that matter. So, well, thank you for that explanation. It was interesting even for me, and I'm involved with it a lot, to hear about how you deal with even the state framing of the issue. And not everything is Sarah Cody's decision. Ultimately, she's got to follow some rules too.
That's right.
So we have a few questions about testing, and someone on Facebook asks, can you discuss the plans for testing at school sites with schools opening soon? And someone has texted and asked, can we have testing on a rolling basis at our senior nutrition program sites?
But I think most of the senior nutrition program sites are now basically to-go food because we can't congregate the people. And this county actually delivers 1.3 million senior nutrition meals per year. So it's a big deal. That tells you there's a lot of seniors that are dependent on those meals. And so basically Meals on Wheels has sort of taken over. The place that we're doing this show today has a senior nutrition program right next to it. And they had to convert to a sort of a box lunch system, so at least people are getting their nutrition. But it is such a good, I recognize the intent, I think, behind the caller's question, because when you have this captive audience of seniors, which is a high risk group,
Yes.
and they're coming in to get meals, naturally, it's a logical thing for people to think of, well, why don't we catch them right there? Same with kids going into schools. If the schools do open up, which is largely the responsibility of school superintendents and school boards, but if they do, what about that? Do you think we'll start seeing testing zooming in on these places where we have a captive audience and we can catch them when they're coming in and out?
Well, I think that the hope is to have much more testing everywhere, everywhere, and as many places as possible. And that's going to take a community-wide effort. Right? We still need the federal government to step up. We still need the state to step up. We need other healthcare systems and providers to step up to make sure the reagent is available, to make sure the supplies are available, to make sure that the resources are available, so that we can be able to have that kind of absolutely widespread testing all over the place. The one other thing I would add is, we are already doing a lot of targeted testing at skilled nursing facilities, right? At places where we know there's a really serious risk that if COVID gets in, there will be a lot of deaths. High risk population, very vulnerable population. And so a lot of energy has been spent in the EOC making sure that those places have personal protective equipment, making sure that we're shoring up staffing, making sure that whenever there's an issue, we go in and ensure everybody's tested. A lot of wraparound support for those facilities, because right from the beginning in Washington State, right, there was that skilled nursing facility with an outbreak and dozens of deaths. It's a huge risk area. So we focused on that. There's a whole dashboard on our website with specific information about long-term care facilities, including skilled nursing facilities, and a very specific focus. And by the way, just a strong message included in the order, even though there are lots of things that are open, this is a really important message. Dr. Cody has been very clear. If you are in a vulnerable population, if you are elderly, if you have certain medical conditions, you are strongly urged to shelter in place to the greatest extent possible because of this risk. It's really significant for those populations.
Yeah, I haven't seen my parents in 3 months and 2 weeks face to face, and they're in their late 80s. I'm fortunate. I'm 64, so I'm fortunate to have my parents with us, and we love them dearly. But that's exactly why, despite the temptation, despite Father's Day, despite Mother's Day, despite some birthdays that came and went, including my own, I can't do that. I can't take that risk. And I think at the end of the day, that's what everyone has to weigh. Later on, when we have a chance, I want you to talk about what I hear from my constituents all the time. We have another question now.
Yeah.
Some of our constituents are ready to, for a declaration of independence because we've done such a great job. And I want you to talk about what the pressures are on us that are coming from a lot of other factors, including external factors that we have to stay the course, even though people have done a terrific job here. So, Tara?
So we have someone texting in their grandson was affected by COVID and they've been free of the illness for 5 weeks. They wanted to know when he can visit, which you just touched on, but also when can he continue his essential activities?
This is, James, I'll let you answer this again. We're just so fortunate to have you here. I want you to give detailed answers, better answers than I can give to a lot of these questions. But one of the first calls I received from a constituent very early in this COVID situation, it was before shelter in place. It was about a week before shelter in place. So I was actually out and about, and everybody was out and about still, and I got a call on my iPhone. It was from a constituent, actually a very recognizable constituent from Stanford University. I recognized the phone number right when I saw it, and even though I was out, I picked it up right away. And she said she wanted her son to come and visit her, but she had a condition, so she wanted her son to be tested beforehand. Well, when I actually called Sarah Cody, got her on the phone, I said, can our lab at the county test her son so they can have a visitation, because she was on her sick bed. She just wanted to see her adult son, and Dr. Cody said, I wish I could help you with that, but I can't do it. And at that time, of course, the national government, it really had not helped at all. They've helped a little bit since then with some money, but there were no tests. There were no labs open.
Nothing back then.
And that's changed now. We talked about the free testing earlier. What should somebody like this do? I mean, there's no guarantee right now because you have asymptomatic carriers. But if you're gonna visit, what's probably the best process to follow?
Yeah, I mean, what I would say is, first of all, the best guidance, the official guidance, the what public health is saying is, if you're in one of those vulnerable categories, you shouldn't be having visitors or family, period, because the risk is significant. There is asymptomatic transmission.
And explain what that is. I use that big word, and you use that big word.
Asymptomatic means people who are carrying the virus, but they have no signs of it. They don't have a fever, they don't have a runny nose, they don't have a cough, they don't feel sick or look sick or seem sick, but they actually still have the virus. And when they are out and about, they're actually spreading it to other people. That's what we mean by asymptomatic transmission. And it turns out with this virus, there's actually quite a bit of that. And that's one of the reasons it's been so hard to contain, because the people themselves don't necessarily feel sick, and so they don't realize that when they're interacting with others, they're actually spreading it. And that's been a huge challenge. So there is that risk. So the public health would say don't have that visit occur, because the risk to those vulnerable, high-risk populations is significant. You mentioned your parents. I haven't seen my mother since mid-February, actually, and it's been really hard for my 4 kids, for my kids to not see grandparents. Really hard, but we care about wanting her to be around. So that's really the number one takeaway. The testing, I'll just say two things about the testing if I can. The standard test, the swab, the nasal swab test, is pretty accurate, and it tells you if you have the virus at that moment in time. But the challenge can be, it can take several days after you're exposed before it registers. And so but that test is only a snapshot in time. So it only tells you that at the time that specific swab was taken, you likely didn't have the virus. You could have gotten it later that afternoon from somebody.
So that's a great point. And I actually had one of my employees, no one present here today, say to me, I want to help, I'm willing to get tested, but what good does it do? And I thought, I wonder how many people think that way. They're not getting tested because they think it's just a snapshot in time. What am I supposed to do? Get tested every 3 days? Or, how do we feel about that? Better once than none at all, or what?
Absolutely, because the more we can have general testing, the more we will catch some of the asymptomatic folks and be able to get them to isolate and get their contacts to quarantine. And if we do that, then we'll help break a chain of transmission, right? We'll help cut off one locus, one point of spread of the virus. And so you're right, it's not perfect, and you're right that it's a moment in time, and so for the individual who gets tested, it doesn't mean you're now free to do whatever for the next 2 weeks. But the more percentage of the population that we can test with the more frequency, the more likely we can actually find and then kind of, put a ring around a spot fire, so to speak. If you think about it like a forest fire type analogy, right? You got these spot fires pop up. You want to jump on those and contain them before they spread. Well, you got to find them first. And the more we will find, the more folks who even folks who don't have symptoms, get tested. Of course, if you have symptoms, we definitely want you to get tested. That's absolutely critical. But we're urging people, especially people who, are coming in a lot of contact with the public. So if you're an essential worker, if you're a grocery store clerk, if you are
a politician,
yeah, absolutely. If you're a delivery driver, if you're in any setting where you may be interacting with many people in the public, you're at higher risk because of the number of interactions, and we want those folks to get tested. They are a priority group. They're part of Dr. Cody's order to the large healthcare systems as a group that must be offered testing.
Yeah, I understand, and I hope everyone does, that all this contact tracing and all this system that's been set up and the protocols that you're writing for these businesses, they're all relevant only to the extent that people test and people screen, right? If you say construction sites can open, but you got to test people, you got to screen people, you can't let people in with fevers, and if somebody does turn up positive, even after all that, you can swoop in, shut that site down, keep it from spreading, and then start contact tracing and figure out who started it in the first place, and go try to clean that up by quarantine. And that's really the point behind the testing at this point, and that's what you're trying to write into all these protocols to make sure there's a way to retrace everybody's steps if something does pop up, right?
Yeah, I mean, one way to think about testing is it's kind of the eyes and ears, right, to see what is going on, right? Where is the virus even? And if you can't see it, how are you going to be able to respond to it? So it's kind of step one. Now, there's a lot of other pieces, but if you can't see it, you're blind. You're operating blind. And that was one of the big challenges early on. And to Dr. Cody's credit, jumping on that shelter-in-place order so quickly, a lot of people waited too long. And it's something that's hard to understand because, the people get a little uncomfortable with kind of the math concepts. But the growth on a virus is exponential, right? That means every day you wait, boom, 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 it just spirals, right? It grows massively. And the difference in a day or 2 or 3 or 4 or 5, basically you look at the difference between Santa Clara County and New York City. They 6 days, exponential growth.
Well, we're with James Williams. It's James Williams that you're listening to today, and he and his law office, which is the county council. His law office is the law office of the county of Santa Clara. It's a public sector law office that's part of the county, which has won some of the most significant landmark decisions, including several at the Supreme Court level since 2016 on behalf of the entire nation. But that's not what he's talking about today. He's been playing a lead role guiding the process of protecting us from COVID, of counseling Sarah Cody and all the other attorneys that you have around her, trying to help make sure that as we proceed, it's being done legally, constitutionally, and of course with a tremendous effort to protect people as we go along and try to get some of our businesses open. That's what you've been working on a lot most recently.
Yes.
Tara?
Yeah, and just related to that, we had a couple folks ask if we'll see hair salons go outside or hairdressers go to folks' backyard.
You know, I'm going to say that James Williams we aren't going to allow him to have to be put on the spot today because he's in an attorney-client privilege dialogue with Sarah Cody, and they're just a couple of days away, I think we can say that much, from issuing, another set of orders and opening up businesses. But maybe you can just generally comment on how seriously issues like hair salons and the need for people in this county to be able to access basic services like that. We know that you have a logistics team also that's fielding
Yes.
Emails and phone calls from constituents, just like we're doing today. Every day that's happening.
Yes.
We know that people, eventually get tempted to go sneak off and try to get a professional haircut somewhere or go out of county. So you're under a lot of pressure to try to accommodate all that. What's that like? And can you reassure people that at some point we've got a pathway to try to get those things open?
Yeah, absolutely. I joked earlier, but obviously I'm one of many people who's eager to have a haircut and to get many of these other services, and that's true not just for me, but the other attorneys and the other, Dr. Cody and the many people who work in the Emergency Operations Center. We have families. We live here. We are part of the community too. And we understand, and we also get all of these inquiries. As you mentioned, we have a whole team. We get, hundreds and hundreds of emails. We get phone calls from businesses. We get reopening plans, and we review all of that. We try to compile it. We see what best practices are appearing. We see what innovative ideas are coming. We have a web form. We have a landing page. It's all accessible through the website that's linked down below, and we take all of that really seriously. And in fact, many pieces of public input, of business input, have been incorporated into protocols, into guidance, into the best practices that have been put out there. So it is vetted. There's a whole team in my office, for example, that helps work with the folks responding to questions. We have very detailed FAQs, and it's an operation that is working 7 days a week, day in, day out, every week, to try to be as responsive as we can be, because we absolutely understand how much of an impact this has in the community. So, we're taking all of these ideas into account. We've got brilliant people who live in this county. We've got people who care a lot about trying to do the right thing. And we are lucky that we've got a great group of folks who are really trying to put all of those pieces together in the best way that we can.
Before we go on to the next question, on the subject of haircuts for a little bit longer in salons, we have had neighboring counties and other places out of state open up. For whatever reason, they felt they could allow hair salons, barbers to open up, and I've read a lot about that to see what they're doing in preparation for some of the county board of supervisors hearings that we have with you and Sarah Cody and Dr. Jeff Smith, our county executive. So I'm prepared, and it does seem to be that a lot of other places have started to figure out how to do that safely. And I'm sure you take that into account, which makes me feel like we're close. We have to be close because a lot of these other places seem to be operating safely, at least in that sector, in that realm. But that said, when you read about the rules that they're using, the ones that are the safest, it's nothing like how it used to be.
No.
There's not going to be anyone sitting in the barber shop or the hair salon with you waiting for an appointment, right? Because in most places that have opened up, you allow one person in there at maximum 50% capacity, so the next chair is going to be empty probably. Your masks on, sanitization going on constantly,
Yeah.
people changing clothes constantly. It's just a different world. People having to either wait outside, or in some states they're not even allowing people to wait outside. It's appointment only, and you cannot come early and you cannot stay late. There's just no overlap. It's not really the usual comfortable,
No.
kick back, have your hair cut, and engage in a big conversation about
That's
the
right.
Warriors or something while you're there, or whatever people talk about.
No.
I just think the whole thing requires a reality check sometimes, that yes, you want to get them open, but you're going to have to make it, to make it safe, you're going to have to make it much different than it is right now.
That's exactly right. And we talk about this, the new normal. I mentioned earlier the face coverings, the social distancing. We in our county, we've been really trying to emphasize with businesses the social distancing protocols. They're required for every single business that's open. You should see before you go in that they've got the, COVID prepared check mark, that they've got their visitor summary sheet up and posted. They are required to have that, and they're required to be taking those precautions for their workers' safety and for the safety of those customers coming in. It includes density, right? Fewer people. It includes distancing. It includes hygiene. It includes making sure that people with symptoms are not coming in. It is different, and we have to. We wish it were otherwise, but we have to come to terms with the fact that for the foreseeable future, we're going to be operating under a new norm of interaction, of distancing, of masking, and these are things that are hard because, to a certain extent, they intuitively feel odd for humans, right? We are very social. We are people. As people, we want to come together for events. We want to come together for celebrations. We come together for funerals. We come together for religious ceremonies. We come together to eat, and we come together to sing. We come together to dance. We come together, shake hands.
To make money.
We come together to make money. Absolutely, absolutely. And it's a huge shift. It's a huge, huge framework shift that's happening all around the world. And until there's a vaccine or until there's something else, this is going to be a worldwide radical shift. And that's hard. It's very hard for all of us.
So reopening's happening, but it's not all it's cracked up to be. That's really the moral of the story. Tara?
This is our last question. We just have a few minutes left. And Frank asks, how will COVID-19 and shelter in place change our lives for the better in the future?
Yeah, that's something we get to talk about at the end of 14.5-hour Board of Supervisors meetings sometimes, but we're all still trying to keep our eye on the ball in terms of, are we learning stuff about telecommuting? Didn't we learn from this that not everybody needs to go down to the office or down to their place of business every single day? That a lot of people can work remotely. Unfortunately, many can't, and those are people right now that we call frontline workers, not just healthcare, but people that are selling your groceries to you or ringing you up and bringing the grocery carts in and out of the grocery store. They're frontline workers too. They're never going to be able to telecommute, but we can get cleaner air. We can start addressing climate change. What are some of the other things you think we can do, James?
Yeah, I love the question because, this is such an opportunity, and we're seeing it coalesce with a lot of other demands for societal change, right? For equity, for justice. And it's an opportunity for us to really step back. And you're absolutely right. One of the first things I noticed when shelter in place went into effect was how many more birds I could hear in the morning outside my house when I was coming into the EOC early in the morning. And even now, even weeks and months later, even though a lot of activity has resumed, I still hear a lot more birds. The sky is much clearer. And it's just a moment of pause, a moment for us to reflect as a society, and to really think about how we want to reshape what we do, what we prioritize, how we spend our money, where we spend our time, how we spend our resources, and whether they actually reflect the values we cherish the most. And so I think that it's a great opportunity to look at the environment, to take care of the earth, to think about how we are set up as a community, think about our economy and how it's structured, to think about how we interact with each other. So we all have a role to play in that process. It's a great reminder of how important it is to have investments in things like public health, right? Public health has been at the federal and state level ignored for decades. And public health's day-to-day job is prevention, right? Community health, holistic well-being. It's an opportunity to remember that those are the kinds of things that we shouldn't be neglecting as a society, but that we maybe have for too long in this country.
There's a little bit of this, you've written laws that sometimes would have taken 2 years and 2 weeks. We've seen things like racism addressed in the last couple of weeks at a more rapid pace than we've seen over the last 50 years. I think there's a certain element out there of people seeing this as a window of time that we need to take advantage of to eventually leap forward once the virus is defeated, and once we have the vaccine for it and the antibody testing, that we don't lose sight of the fact that we do need to spend more time with our families. I do in the evenings now, since I can't go to all the political banquets. I get to take walks in the evenings, and I see families out that I never saw out before, walking around. It's a beautiful thing, and I think it's something that we don't want to lose. So thank you. Are we at the end of our time, Tara? And I want to ask people to make sure to contact our office if you had questions and they weren't answered. We try to keep track of the ones that are coming in, that are posted or texted, so that we can continue to respond after today, including Monday. Tara and Janice Rombach and Tevu will take care of that, and I'll take care of some of that too. But if something comes up 5 minutes after this ends and you think of something, by all means call us Monday, 408-299-5030. We're more than happy to answer your questions, or use one of the contact numbers or listings, websites that are on the screen right now. James, thank you so much. We know how precious your time is, and thank you for coming down here and letting people know that there's a real legal expert that's back there working on all this stuff, and that you're giving a lot of thought to it, and that you care. We appreciate that you care.
Well, thank you so much. Thank you.
Right.